Is chronic spontaneous urticaria curable? Are CSU hives contagious? Is it true that women are diagnosed more often with CSU than men? Get ready to have these myths busted and more. This episode is produced in partnership with the Allergy Asthma Network, and we want to thank Novartis for sponsoring this episode. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology. We're doing something a little bit differently today. We're doing a myths and misconceptions episode all about CSU. CSU is chronic spontaneous urticaria. In case you don't know, and this is your first time tuning in, we have a whole series behind us. So if you're interested in a little bit more of a deep dive on chronic spontaneous urticaria, go check that out. So this is going to be a quick fire round. Are you ready, Dr. G?
I am ready.
All right. Our first question is, CSU, chronic spontaneous urticaria, is caused by allergies.
Hives are a common symptom of allergies, and we know that because histamine is a big part of allergic reactions, and histamine is what causes hives. However, with chronic spontaneous urticaria, we're dealing with something different. And in chronic spontaneous urticaria, there is no identifiable allergen or trigger in patients. We're learning more and more about CSU, and we know it's maybe caused by an autoimmune disorder in the body and not external factors causing the hives. So again, it's not something like a cat or a dog or a food. It is internal that's causing the hives in CSU.
So just to quickly do a summary on that, allergies aren't the cause of chronic spontaneous urticaria. Spontaneous is the key word there, so you don't know what triggers it. But you do know that it's something internal versus external, and an allergy is external, so obviously an allergy is not related to chronic spontaneous urticaria. Great. So, next question. CSU is contagious, and I'm going to just add a little something on that, and I think that comes from the idea of when people see hives, they think that hives are contagious because they're rashy and kind of weird looking. So when we say, is CSU contagious, I think it's, are hives contagious?
So that's a myth. CSU is not contagious and cannot be transmitted through physical contact. So when we think about things that are contagious, that means that touching somebody with something can cause them to get that. So scabies, for example, is very contagious. So when somebody has scabies, which is actually a mite infestation of the skin, that mite can move from one person to the next, and that person will then get scabies. CSU does not transfer from one person to the other. So if you have chronic spontaneous urticaria, you can't give it to somebody else. And if they have it, they can't give it to you. And that's true for any form of urticaria, actually. Hives are not contagious.
Great. Thanks, Dr. G. The next myth is CSU is rare.
So CSU is actually not that rare. It affects a significant portion of the population, and there are approximately 1.7 million people with CSU. So it's actually more common than often perceived, which can be helpful to people to know that they're not alone in dealing with this condition.
Next one is CSU is not a serious condition because you know what? Hives are just hives, right?
So CSU can actually significantly impact someone's quality of life. And we say this about a lot of allergic conditions, but just because it's not life-threatening does not mean that it's not a serious condition. So when we talk about quality of life, what that means is how good or bad someone feels about their life overall. And when we look at quality of life factors, we're looking at things like sleep, work function, home life functioning, and things like that. And with CSU, because specifically of the itch factor, we have people that have significant impact on their quality of life because they cannot concentrate at work because of the itch. They cannot concentrate at school if they're a child. They cannot sleep at night. And if you can't sleep at night, means that you're going to be sleep deprived in the morning and you're not going to be able to function because of that sleep deficit. So it's a vicious cycle. And all of that can cause people to become anxious and actually depressed because it's a chronic condition and it's happening for greater than 6 weeks and sometimes for years for people. It can really cause a disruption in people's lives and can lead to significant psychological issues. So people with CSU have the itch, but they also have this rash, right? And we talked about it not being contagious. But if you think about it, rashes can make people very uncomfortable because of the appearance. It can appear on their face, it can appear on their chest, on their neck, on their hands, all over their body. Sometimes people are covered head to toe. And so that can be very uncomfortable because other people feel like you may have something that's contagious or that you're infected with something. And so that in itself can also cause a lot of anxiety and depression for people with chronic spontaneous urticaria.
All right, so yes, CSU is definitely a serious condition because it can impact your quality of life. And just to summarize, what that means is things like sleep, work, or school, your relationships, those are all impacted because of what the CSU is doing to your body. For instance, the itch makes you uncomfortable and you can't sleep. If you can't sleep, it has a whole knock-on effects. You also have hives that are something that's seen, and that can also do something to you when you feel like people are looking at your hives, going out in public. That impacts your quality of life. So saying that CSU is not a serious condition is totally untrue. Next we have, and this lends very nicely into what we just spoke about, is that stress is the main cause of CSU.
So while stress can exacerbate CSU, meaning that the symptoms can get worse if people are under stress, it is not the root cause. So again, we don't understand clearly what's causing the hives in CSU, but we think it may be related to an autoimmune issue in the body. And so managing stress is an important part of what I tell my patients to do.
CSU, chronic spontaneous urticaria, only affects the skin.
So that is a myth. CSU can also cause deeper swelling or angioedema. And this can occur around the eyes, the lips, even the hands sometimes. And this can be more severe and uncomfortable than even the hives themselves.
So just to recap, CSU, you've got hives and or angioedema, and angioedema is swelling, so it doesn't only affect the skin. CSU will go away quickly.
So myth. Chronic spontaneous urticaria, remember, by definition, are hives that have been present 6 weeks or longer, and they can be present for months or even years. So they don't necessarily go away quickly. However, if you're talking about the individual hives themselves, those do come and go. And that's also a part of the definition of CSU. So an individual hive will come and go within 24 hours. So they do technically come and go, but actual CSU can last for months or years.
There isn't any treatment for chronic hives.
So CSU actually has many different types of therapies available. And that's sometimes what people don't realize. And actually, even certain doctors don't know that there are other treatment options available for chronic spontaneous urticaria. So they can be challenging to manage at times. However, there are treatment options like antihistamines, which is the first line of therapy, but then there's also biologics like omalizumab and other immunosuppressants. So working with a healthcare provider is crucial to find the right treatment plan so that we can treat your hives and improve quality of life.
Antihistamines are the only treatment for CSU.
So currently, antihistamines are the first line treatment in chronic spontaneous urticaria. However, approximately 50% of people don't actually feel that they get complete control of their symptoms, even if they're on high doses of antihistamines, and they continue to live with those distressing symptoms of chronic spontaneous urticaria, like the itch, for years before getting effective treatment. So while antihistamines do help, and they can help in managing symptoms for many people, other treatments like the immunosuppressants and biologics may be necessary for more severe cases. So it's important to discuss all options with your healthcare provider, especially if you're not getting relief.
Changing your diet will help your CSU.
So that's a myth. Changing your diet will not help in CSU. I have many patients that come in that are on very restrictive diets, and that actually is causing more stress than it actually being helpful. So CSU is not caused by external factors, again. So even if you change your diet, that's not going to change whether or not you get the hives or not, because it's more internal than it is external.
CSU can be cured.
That is a myth. So there is technically no cure for CSU, but we have effective treatments that can help reduce the symptoms and improve quality of life. In 30 to 50% of cases, the symptoms will go away within a year of diagnosis on their own, but you may have symptoms for longer than 5 years. So 1 to 5 years is the average length of time for CSU. So again, it cannot be cured. And you have to remember that the treatments that you're on, once your hives have improved and you haven't had hives for a certain period of time, your healthcare provider may start taking you off of some of those medications, and you may successfully come off of all medications. And so you may feel like your hives have been cured, but the CSU could come back at a later date. So it's not technically curing your hives.
Once CSU goes away, it will never come back.
So you can get episodes of CSU at different points in your life. It may go away and then come back at a later time.
Men and women are equally affected by CSU.
That's a myth. So although anyone can have CSU, statistics show that women get it twice as often as men.
You can always pinpoint the exact cause of hives in patients with CSU.
Myth. So you can't always pinpoint the exact cause of hives, especially in patients with chronic spontaneous urticaria, because external factors are not what's causing chronic spontaneous urticaria. Chronic spontaneous urticaria, the more we understand what the exact cause is, we're finding more and more that it may be related to an internal autoimmune condition rather than any external factor. So again, most patients cannot pinpoint the exact cause of their CSU.
Just to see if I understand what that answer meant, is that you can't say there's something that is actually from the outside coming in and giving you the CSU. It's something that's happening within the body, but we're still not sure what exactly it is inside the body that's causing the CSU.
Exactly.
Okay, great. Autoimmune conditions are more common in people with CSU.
That is actually true. So people with CSU are more likely to have autoimmune disorders, conditions like thyroid disorders, celiac disease, Sjogren's syndrome, lupus, rheumatoid arthritis, type 1 diabetes are more common and prevalent in CSU patients than the general population.
Scratching hives is harmless.
So that is a myth. So scratching our skin can actually be very harmful. Our nails are full of a lot of bacteria, dirt, and things that we're not even aware of. And so when we scratch our skin, we're actually harming that top layer of the skin and sometimes even getting deeper. So because the itch is such a big factor in patients with chronic spontaneous urticaria, at night, early in the morning, when people aren't even aware of what they're doing, they can cause a lot of damage to their skin. And when you break open the skin, that can lead to infection, which can become a serious complication.
So basically, don't scratch. As hard as it can be, don't scratch.
Exactly.
Once my hives are controlled, I need to be on the medication forever.
Myth. So no, you will not need to be on medications forever. Once hives are controlled for a length of time, your healthcare provider will work with you to try to see if your body is ready to come off of your medications. And again, that doesn't mean that the chronic spontaneous urticaria couldn't come back at a later date, but you may be able to come off of medications for a significant portion of time.
All hives look the same.
That's a myth. So hives in particular can vary in shape, size, color. Some may be small and clustered, while others can be large and spread out. The appearance can actually change even in an individual person over time. And hives in different skin tones can also appear different. And that's really important to remember because oftentimes healthcare providers can get confused about the diagnosis because hives can look so different in different color skin.
Only adults get chronic spontaneous urticaria.
Chronic spontaneous urticaria can actually affect any age group. So that means it can affect children and adolescents just as much as it can affect adults. However, the most common age that CSU presents is in the 20s and 30s.
CSU hives are always accompanied by other allergic symptoms like swelling or difficulty breathing.
That is a myth. When people have CSU, they can have angioedema, which is a deeper swelling of the skin. However, they should not have symptoms like difficulty breathing or a drop in their blood pressure, for example. If you have symptoms of difficulty breathing, drop in your blood pressure, and hives and swelling, then that might be something more serious like anaphylaxis. So anaphylaxis can occur to foods, drugs, bee stings, things like that. And that is a different condition than what chronic spontaneous urticaria is. However, I would like to say that somebody with chronic spontaneous urticaria could also have a food allergy, for example, and also experience anaphylaxis at some point. But that's not related to their chronic spontaneous urticaria.
Having CSU doesn't affect quality of life.
So CSU can significantly impact a person's quality of life and daily activities and emotional well-being. So many people with CSU experience anxiety and depression because of the chronic nature of the condition and how much that itch affects their daily life. So itch, again, is a big factor, and it can affect the way someone's sleeping, the way someone's able to concentrate at school or at work. Even being able to have a conversation with somebody can be affected by that itch.
The itch in CSU is not a big deal.
That is a myth. The itch in CSU is actually the biggest deal. And so something as seemingly small as an itch can actually cause profound discomfort when it lasts for weeks or months or years. So imagine having mosquito bites all over your body constantly. And that's something that people have a hard time understanding. But when you have CSU, that itch is present all of the time. And so learning how to deal with that itch and how to manage that itch is a very big deal and can cause significant quality of life issues.
Yeah, the itch is a big thing. And I think it's hard for people to understand because with CSU, you can see the hives, but you can't feel the person's itch. And that's why it's so uncomfortable. And I think that's why this podcast series is so important because you can see part of the disease, but you can't see the other part that's really, really impacting the person psychologically. So itch, and that's from someone who has itch from a different condition. Itch is huge. It's really a huge deal for a lot of people when it comes to just quality of life. Allergy testing will help me figure out why I have CSU.
Big myth. So allergy testing for foods and environmental triggers is not needed for people with chronic spontaneous urticaria. Oftentimes, people do have allergy testing done, and that's because it helps people feel like they've really dotted their I's and crossed their T's and looked at every single aspect possible. So you can, again, have environmental allergies or have food allergies that can lead to hives, but chronic spontaneous urticaria is not caused by those food or environmental triggers.
Great. Thank you so much, Dr. G. Those were all of the myths and misconceptions that we have for CSU. I hope you guys like this episode. It's a totally new format for us to do such a quick fire round instead of a deep dive. So let us know what you think in the comments, and maybe we'll be doing another one soon.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.